Hello, everyone. I'm Dr. Carmen Puliafito, and welcome to Retina Synthesis. I'm happy to have with us today Dr. Arshad Khanani, who is Director of Research at Sierra Eye Associates in Reno, Nevada, and is an Associate Clinical Professor at the University of Nevada Medical School in Reno. Arshad, welcome to Retina Synthesis.
Hi, Carmen. It's a pleasure to speak with you, and I'm glad to be back.
So today we're going to talk about the use of ocular drop therapy for the treatment of diabetic macular edema. Can you tell us about the drug and the rationale?
Absolutely, Carmen. So OCS-01 is a topical dexamethasone eye drop, and I presented the stage 1 data from the phase 3 Diamond study recently at the Clinical Trials at the Summit meeting. So, as a field, we have always been looking for eye drops to treat retinal conditions. And in the past, there have been many failures. So this drop, OCS-01, uses a technology that allows the penetration of the eye drops and really delivering to the retina. And we know dexamethasone works in patients with diabetic macular edema, especially knowing that these patients have inflammatory component to their disease. So this drop has been studied in earlier stage studies where we saw a benefit in terms of improvement in anatomy and visual acuity. The data from phase 2 has been published. So that's why the phase 3 program was launched. It's called the Diamond study. And the idea was to do a stage 1 of this study to look at optimal dosing and also to look at biological activity. So in the stage 1, 148 patients with DME were involved. They could be naive or previously treated with a washout, and they had to have CST of greater than 310. And the idea was these patients were given OCS-01 6 times a day. Now, this was a randomized study, 2-to-1, and patients were randomized 2-to-1 into OCS-01 or a vehicle 6 times a day. So they received the topical eye drop 6 times a day for 6 weeks. And then after that, they received the eye drops or vehicle for 3 times a day. And then the study was 12 weeks. And I shared the data for the full 12 weeks at Clinical Trials at the Summit. And the idea was, number one, obviously, is efficacy. Are we seeing any benefit in terms of visual acuity? Now, patients in this study had lower visual acuity because we want to show there is a delta. So the inclusion visual acuity was 24 to 65 letters. And if you look at the baseline characteristics, it was about 58 letters in both groups, but the CSTs were quite thick, around 440 to 450 microns. So really severe DME patients. And what we saw was the study met the primary endpoint at 6 weeks, where there was a rapid improvement in visual acuity in patients treated with OCS-01 with an increase of visual acuity of 7.2 letters compared to vehicle, which was 3.1 letters. The p-value was 0.007. And then the other thing is to note is that this visual acuity maintenance happened after the loading phase. So 6 times a day for 6 weeks and 3 times a day. And what we saw was this visual acuity stayed good even with 3 times a day, really telling us that for the next stage or stage 2 of the pivotal program, we can go to 3 times a day after the loading phase. And we had 25% of patients who had 3 lines or more improvement at 6 weeks in patients treated with OCS-01 compared to 9.8%. P-value was 0.015. And looking at anatomy, there was a decrease in CST of 64 microns compared to vehicle, which was no improvement. So bottom line is that we are seeing biological activity with visual acuity improvement, with increase in 3-line gainers, with improvement in anatomy in patients who are treated with the topical OCS-01 dexamethasone eye drop. Now, of course, it's a steroid, so we watched for IOP increase and cataracts. There was no increase in cataracts, but this was a short 12-week study. But in terms of IOP increase, we did see any IOP increase in 22% of patients. But the good news is that only one patient had an IOP of 35 or greater. And if you look at the averages, the increase in IOP never went above 3 in the treated group. So we are seeing an IOP increase, but not as much as we see with intravitreal steroids. So that's the bottom line, Carmen, for OCS-01 showing efficacy with a topical non-invasive approach in patients with DME.
So what's the concentration of the dexamethasone again?
So what happens is that you have 15 milligram per ml, and it's the high concentration, obviously, and it uses this proprietary technology called OptiReach, and we can discuss more into that technology later, but it has certain components. You have the drug molecule, you have the cyclodextrin, you have this complex, and then it's a water-soluble complex that penetrates, but the concentration is 15 milligram per ml.
So how would you envision using this in real-world clinical practice? What patients would be ideally suited for this approach?
Well, so Carmen, this was seen, obviously the trials were done in the severe patients, as I said, low visual acuity, thick CST, but I think this has a potential in multiple different patient subtypes, right? So number one would be a patient that has early DME with relatively good vision, where the risk benefit of intravitreal, anti-VEGF may not make sense. And if you're seeing early signs of DME, you can give a topical eye drop that's non-invasive. And of course, if you have IOP increase, you can stop the drop and the IOP will come down, as we saw in the phase 2 trial. So early DME patients who are currently not being treated. Number two would be patients who are on anti-VEGF and who are suboptimal responder, and the number could be anywhere from 30 to 40%. We can add OCS-01 in those patients who are getting anti-VEGF injections. And the other patients will be, we control those patients acutely with anti-VEGF and then maintain with OCS-01. So I think the potential of this approach is quite large in terms of number of patients treated, because again, you and I both know the first thing patients with DME ask when we offer injections is if you have a drop or a pill. And if you have a drop that can actually help these patients and have, a safety profile that can be managed, I think that could be very beneficial for our patients with DME.
What's the next step for this product?
Yeah, so based on the positive stage 1 data from the Diamond study, now 2 trials are being designed, and they will be launching later this year. So you'll have 2 large pivotal global studies with an endpoint, of course, of 1 year to look at safety and efficacy of OCS-01 in patients with DME. So I'm excited to be a part of those studies. I was part of the Diamond study too, Carmen, and I was masked. And, so of course I didn't know what the patients were getting, but there were some patients who had rapid improvement in anatomy and visual acuity. And I thought maybe, it's just, I'm biased because I'm masked, but actually it turned out to be true. So yeah, looking forward to participating in the pivotal program that's going to launch later this year.
Well, thanks so much for joining us on Retina Synthesis and updating us on this very exciting development.
Thanks, Carmen. It's always a pleasure to speak with you.
Thank you.